Hi there, I'm Dr. Dan Wall. I am one of the emergency medicine attendings here at McLaren, Oakland, and I'm also the medical director here in the emergency department. It's a pleasure to be with you today as we talk about our STEMI program. We are extremely excited about the success of the program and very grateful to all of you who have brought us cardiac patients over this last year. When you bring us a patient from the field, rest assured that we are going to take very good care of these patients. With over 80 activations in the last year and 40 interventions, our door-to-balloon times are right around 60 minutes, which exceeds the national standard, and we're extremely proud of that. You've trusted us for years with trauma. The success of the STEMI program over the last year shows that we're making a difference, and we've got plenty of success stories to prove it. Now let's go up to the Cath lab and meet Dr. Zacharias, who's one of our interventional cardiologists. We're up here in the Cath lab with Dr. Zacharias, one of our interventional cardiologists. Thanks so much for being here with us.
Happy to be here. Thanks for inviting me.
So what are the capabilities of the Cath lab and what are the capabilities of the Cath team now that we are a cardiac hospital and a STEMI program?
So our cardiac program here at McLaren, Oakland, has really stepped it up now. We are able to take care of patients that can come in with acute heart attacks. So these are emergencies that happen in the field. When these patients are brought to McLaren, Oakland, we can actually meet them downstairs in the ER, and then we can rush them right upstairs to our cardiac cath lab and perform life-saving procedures.
Are there any limitations to what the cath lab can do when a patient comes in from the field from EMS?
Not really. When the patients get here, they are met by our ER staff and our cardiology team downstairs. For the patients that have heart attacks, which really is the focus, they are rushed up to the cath lab right away. We're usually able to do these procedures either through the wrist or through the groin, and our goal is to treat a heart attack really within 90 minutes. Time is muscle, and so our goal is to get patients on the cath table and get them treated as quickly as possible to help their heart muscle function as good as possible.
And I understand that the national average for door-to-balloon time is a goal of 90 minutes, but here at McLaren, Oakland, coming to the end of our first year as a STEMI program, our average time is around 60 minutes. Is that correct?
That's true. I think we've been very lucky because we have an awesome team. The team starts downstairs from the ER, and we've got a fantastic cath lab staff that is really, really well trained. And we rock and roll. We get people up here real fast and get them treated as quickly as we can.
In terms of transfers, is there anything that we really have to transfer a whole lot of out of McLaren, Oakland? Because I know that was a big thing a little while ago, was we would have to transfer a lot of patients out. But since becoming a cardiac hospital and a STEMI program, are there a lot of transfers that we have to make out of this facility, or can we treat mostly everything here?
Yeah, so I think actually one of the whole points and one of the goals of creating the STEMI program here was to keep everything here at McLaren, Oakland, or within the McLaren system. So the majority of our patients, 95% plus, they get treated right here in the cath lab, and that's when we take care of acute heart attacks. There are some patients that have what's called triple vessel disease. So those patients that have severe blockages in multiple arteries, those patients are actually best served by open heart surgery. So those are really the patients that we end up having to transfer out to our other McLaren sister facilities to get treated adequately.
And it's my understanding, based on our numbers, that the transfers out for open heart from our STEMI activations has only been one case this entire year.
Yeah, really, quite frankly, emergent open heart surgery for triple vessel disease, or what's called left main disease, which is the most critical artery in the heart. It happens fairly uncommonly, and I think in the past year here, we've only transferred one patient. So our goal is to take care of our patients here at McLaren, Oakland, but when we have to advance to the next level of care, the great thing is, when the transfers do happen, we take care of it with the help of our cardiovascular surgeon.
So it's much faster, is what you're saying, to keep it within the same health system, because they're already expecting that patient at the sister facility, as opposed to restarting going to a different facility, which may or may not be closer geographically, but from the patient's perspective, keeping the care within the same team. Is that correct?
Oh, absolutely. I think that's one of the advantages of bringing patients to McLaren, Oakland is we have a regional cardiology presence. So when we take care of patients here at McLaren, Oakland, if we have to send them to our sister facility at McLaren, Macomb, we are the ones that are actually seeing the patient. We have the same medical record system. So there's no work that's redone, there's no repeat testing. It's all time of flight, so it's real-time information that we don't have to repeat. And we think that that's actually the best way to treat our patients more efficiently.
Oh, that's awesome. Is there anything else you'd like to add about the program or anything else you'd like to say to the EMS crews about the cardiac program here at McLaren Oakland and the new STEMI program?
Yeah, I mean, I think starting a STEMI program here at McLaren Oakland is really a game changer. It steps up the cardiology presence here in Pontiac. And because we are a group that goes to several facilities, we have the ability to pull resources from different places. And I think that just makes the ability to treat our patients that much better. So we're really excited about it. It's been a great, successful year, and we're looking forward to growing it even more.
Absolutely. It's been a great success on our end, too. And we really appreciate everything you guys are doing for the patients here at McLaren Oakland and everybody else in the community that brings their patients here to us.
Yeah, and that's really what it comes down to, is taking care of the patient. So the fact that we can do it all here, one-stop shop, or get help from our sister facilities, in the rare cases we need it, I think that ultimately serves our patients the best. And so that's really what it's all about.
Thank you for joining us. We're very excited about this STEMI program as we come to the end of our first year, and we look forward, like Dr. Zacharias said, to growing the program with your help. And thank you again for trusting us with your patients as we transition our minds from being just a trauma hospital to a trauma plus cardiac hospital where we can take care of everybody in the community for all of your needs.